Hello everyone, I am Dr. Subh Agarwal and I welcome you to Holistic Workshop. I am going to be a companion today and let's together do 30 deep breaths. So here is the technique. Take a deep, slow breath, inhale through your nose, hold it for 4 to 5 seconds and then exhale. Wait a few seconds and then begin that cycle. And we will do 30 deep breaths together. So here we go. Inhale. Hold your breath for 5 seconds. And slowly exhale. Inhale. Hold your breath for 5 seconds. And slowly exhale. Okay folks, you have successfully completed deep breathing. Now we will demonstrate prone breathing to you. Lie down prone, meaning on your belly. Put a pillow, be comfortable, and just breathe normally now. And as you can see, it will open up your lungs. Slow, relaxing breaths. Inhale and slowly exhale. So we just finished deep breathing and we finished prone breathing. So what are the advantages? Well, I touched upon that in my previous video. When you take a deep breath and hold it for 4 to 5 seconds, you give time, increase the surface area so that the oxygen can diffuse into our blood and get to where it needs to go to the tissues. We prevent collapse of our lungs, prevent atelectasis, recruit more alveoli, and improve oxygenation. That's the goal of deep breathing. And when you do prone breathing, which we just did today, you have to realize that a large majority of our lungs are inferior, meaning below, and posterior in the back. So these are the dependent areas of the lung. The secretions get there when we get infection. The lung collapses, we get atelectasis, and get pneumonia. So when we are prone and breathing, those areas are open. And you're trying to prevent the infection of the lung in that process. So that's the major advantage of prone breathing. So you can practice that at home, even if you're not infected, to keep that part of the lung well ventilated and prevent infections, whether during this pandemic or any other infection. We are trying to prevent infection. That's the goal. And if you are unfortunately infected, to aid in recovery. So this has been studied, this has been known in medical literature. We promote and recommend deep breathing exercises in our post-operative cardiovascular patients in the ICU. And studies coming from critical care medicine in ventilated patients shows substantial reduction of death, mortality in patients who were prone compared to supine breathing. At 30 days and 90 days, the mortality reduction was staggering at 60%. So this is huge. So I hope this video helps. You find it useful. Continue doing this guided breathing, which we did today, and share with your friends and families. Please subscribe, leave a comment, join the revolution, and begin your own journey to health and happiness. Thank you for watching.